Hi, my name is Zain Hashmi. I'm an assistant professor in the Division of Trauma and Acute Care Surgery at the University of Alabama at Birmingham. Trauma centers provide life-saving care for severely injured patients, but nearly 30 million, mostly rurally located Americans lack timely access to trauma centers, leading to disparities in injury outcomes. The traditional solution of establishing new trauma centers is slow, costly, and impractical in many rural areas. As a result, access to trauma care and clinical outcomes among injured rural patients have not improved in over a decade, prompting a search for alternatives. In this paper, our work group explores the potential of using telehealth to improve timely access to trauma care in rural areas. Telehealth is defined as the use of information and telecommunications to provide healthcare access across time and/or distance. Provider-to-provider teletrauma, where rural providers and trauma care experts communicate in real time via audiovisual communications, can enable knowledge transfer and delivery of critical trauma care expertise to injured rural patients. In this paper, we describe several potential benefits of teletrauma, including improvement in patient outcomes and patient and provider satisfaction. With this, we have also described a few successful teletrauma programs, their experiences and outcomes. However, we note that teletrauma is not being widely used and recognize certain barriers to implementation that remain unresolved. With the expansion of telehealth, barriers common to any telehealth program have either been resolved or at least have some precedents available to inform teletrauma implementation. However, trauma-specific barriers, such as evidence-based clinical workflows and staffing models, have largely remained unresolved. Currently, there are no telehealth implementation toolkits, and there is no consensus among the broader trauma care community regarding the standards and verification of teletrauma programs. These seem to be major barriers hindering progress. Our work group has made 3 distinct recommendations in our call for action. We recommend convening multidisciplinary partners to define priority research areas in teletrauma, develop teletrauma implementation toolkits to standardize delivery of remote trauma care, and ensure representation from rural providers as well as patients and their advocates to drive both research and programmatic growth. We believe that the Committee on Trauma, with its engaged membership and established relationships, can help guide such collaborative efforts aimed at improving rural trauma care through innovations in telehealth. Thank you for your time.